As of today, August the 5th, a total of 6.8 million Africans have been infected with the COVID-19 virus. And this represents a 2.4% total cases if we compare that with the global cases of the pandemic. The total number of deaths on the continent stands at 173,000 deaths, with a case fatality ratio of 2.5%. And this accounts for 4.1% of the total global deaths for this pandemic. The following 5 countries account for over 63% of all cases on the continent. South Africa, 36%, Morocco, 10%, Tunisia, 9%, Egypt, 4%, and Ethiopia, 4%. 3 countries, that is Egypt, Somalia, and Sudan, are recording a higher than average case fatality rate of 5%. If we look at the third wave, 58% of our member states are now reporting the third wave, and that represents 32 countries, 32 of the 55 member states. 25 of them, and that is 78%, are experiencing a very severe third wave. And we can discuss those countries during the question and answer session. Since the last briefing, Nigeria has also joined the list of countries with experiencing a third wave. And 3 countries are actually experiencing a fourth wave. That is Algeria, Kenya, and Tunisia. The situation of the variants has not changed much since last time we briefed. So let me now discuss the trends that we are observing on the continent for the last 1 week and then for the last 4 weeks. So let's start with the first, the last week. Over the last week, we recorded 273,000 new cases across the continent. And that represents a 14% average increase of new cases. And the highest proportion of these new cases came from Southern Africa with 48%, Northern Africa 38%, East Africa 7%, West Africa 4%, and Central Africa West 1%. In terms of new deaths, we recorded a total of 6,454 new deaths over the last week. And that represents an increase of, that represents a slight decrease of 4% of deaths compared to the last week. So in terms of the last 4 weeks, the number, that is the week between the 5th of July and 1st of August, the continent has seen a persistent increase of average of 2% increase of new cases across the regions. And the breakdown by region is as follows: 37% increase in Western Africa, 24% increase in Northern Africa, 3% increase in Central Africa, 3% increase in East Africa, and 7% decrease in Southern Africa. And this is mainly due to the vast decrease that we are experiencing now in South Africa. In terms of the new deaths over the last 4 weeks, the continent has observed a 6% average increase in the number of new deaths, with a breakdown by the most populous countries as follows: Nigeria, 89%, DRC, 29%, Ethiopia, 12%, Kenya, 8%, South Africa, 7%, and Egypt, 26%. So in terms of testing, as a continent, we have conducted, as of today, about 60 million COVID tests. And over the last week alone, 1.6 million tests were conducted. And that represents a remarkable increase of 29% compared to the previous week, which is very encouraging news. The cumulative positivity rate stands at 11.4%, with a test per case ratio of 8.8%. 29% of our member states that are still at a very high, are recording a very high positivity rate. Let me now discuss the vaccine situation, which will be a segue to introducing the topic of the day, which Mr. Masiyiwa will discuss. But let me give you an overview, a panoramic view of the vaccine situation on the continent. As of the 2nd of August, a total of 103 million doses of COVID vaccines had been procured in 53 member states in Africa. Of that number, 70.6 million doses have been administered. The total coverage, that is people that have received a full immunization, 2 doses, stands at 1.58%. So today, in my view, is a historic day. And what will follow after my brief remarks is an update from Mr. Masiyiwa, who is going to give you an overview of what some breaking news, some very, very exciting breaking news. And I'll let Wynne introduce Strive again, and then we can liaise with him directly. Thank you.
Thank you very much, Dr. John Nkengasong, Director of the Africa CDC. And indeed, there is great news that Mr. Masiyiwa will be announcing today. And it is a follow-up to what he was telling us before about the acquisition and distribution of COVID-19 vaccines across the continent. So let us give him the chance to update the continent on those really huge steps that have been taken by the African Union through the Africa CDC and AVAT to make sure that we have enough vaccine doses across the continent. Mr. Masiyiwa, you have the floor.
Thank you very much, colleagues. Good to see you, John. It's great to see you all this morning. Thanks, Wynne. I think I have a slide presentation for you this morning to just give us the context. Is my colleague with the slide show up? I'm also trying to be like John. John is very good with slides, you know, I love John. Do we have the slides?
And Strive, if you can just tilt backwards so that the camera is continued mid here. Yeah, okay, yeah, that is perfect.
Let me just sit back a little. Okay, yeah. I will do that.
Yes, that is perfect.
I'll do that as well with the camera. Do we have the slides?
Is it being projected from our side or your side?
It should be projected from your side. There should be somebody putting up the slides. But anyway, let me start while they work on the slides. Perhaps one of the team can look into the issue of the slides. But I can speak to what I have in front of me. I am sure that all the members of the media by now have received the press statement that was released this morning from the office of President Ramaphosa of South Africa, who is the AU champion on this crisis. That statement announces that as of today, vaccines have begun to arrive in African countries. We started with the country of Togo. They are set to receive their first shipment of vaccines as part of their national order. A total of 11 countries, shipments have left as of today, going to different parts of the continent. I can read the list of the countries whose vaccines will arrive by this weekend. Togo will receive 118,000 vaccines. Lesotho, shipment, I left yesterday, it should arrive on Saturday. They will receive 108,000. Mauritius is receiving 108,000. Ghana, theirs is arriving Saturday morning, and they have 177,000. Tunisia, 108,000. Angola has its shipment leaving. Cameroon will receive its shipment this weekend. Egypt is set to receive its shipment tomorrow. No, on Monday, 1 a.m. in the morning. Botswana will receive its shipment early next week. This first group of 11 countries is alongside 6 Caribbean countries who will also get their shipments from Monday. The Caribbean countries, as you know, are part of AVAT. There are 9 Caribbean countries that are participating. The first 6 shipments go out early next week. We are shipping in batches, and our target for this month is 35 countries who have placed their orders and fulfilled their commitments in terms of the various things that are required to be met in the shipments. An additional group of countries is at different stages of processing their orders and their payments. Even though their orders have arrived with us, they haven't made the August cut. They will receive their vaccines if they complete all their requirements. They will receive their vaccines in September. The shipment of August is 6.4 million doses. It will rise up to 10 million doses next month and will exponentially continue to ramp up until we're at 25 million doses a month by January. We intend to clear all 400 million doses by September next year, as I mentioned before. Are my slides available yet? Okay, I will continue to speak. I wanted to show you the slide showing our projected shipments for the next, how these 400 million doses will be released. Now, as I pointed out to you previously, the Johnson & Johnson vaccine was chosen because it is a single-dose vaccine and that it is also produced in South Africa and was the only vaccine available to us in the volumes that we wanted. Our target vaccination is 60% of our population, which is 780 million people. You can vaccinate those 780 million people either using a double dose regime, a single dose regime, or a combination of both, as my good doctor John has kindly advised. So if you look at the 780 million, we add an additional 20 million to the 780 million to cover the Caribbean member states. That means our target is 800 million doses. Under the agreement that we made with the donor community, that our leaders made with the donor community in December last year, the donor community pledged to provide, my slides are coming up now. The donor community pledged to provide 50% of our requirement through COVAX. We therefore pledged to provide the other 50% of the requirement. That is enough vaccines to vaccinate 400 million people. That is why AVAT was created, to supplement what the donors had promised. So we today declare that we've met our end of the deal. We expect that the donors will meet their end of the deal, even though they are significantly behind the targets that they themselves gave us. So let me, so I hope that you will all read President Ramaphosa's statement. I've already gone past what this slide says. Can you take me to the next slide, please? So the first shipment is arranged as 220 million doses, as you can see from this slide. It shows you our first shipments beginning to go through beginning August, which is what we target to get the 6.4, and we will continue through. This does not include the separate shipments to South Africa, which is part of our VAT, but whose contract had to be separate because of its higher income position. So there's an additional 31 million doses from Johnson & Johnson that are concurrently being shipped to South Africa as we proceed. So I want to draw your attention to the green coloring. This we've never shown you before. So I really beg your indulgence. So you see in green, that is the MasterCard donation. You will recall a few months ago, Dr. John May had a significant signing ceremony, which was attended by President Ramaphosa and President Kagame. We invited you as members of the press to that historic day when MasterCard Foundation pledged $1.3 billion towards our work. And they specifically chose to work directly with us. So they're the only donor who chose to work directly with us. And they've participated in the actual purchase of our vaccines, contributing 500 million of the 2 billion that we ourselves put in. So their donation is shown in green. It is free. So the member states from November that are participating in this will begin to get their share of the 67 million doses financed by MasterCard. There is also a small amount, which I must acknowledge, because it's a lot of money. There was a donation of $25 million also made by the MTN group of companies. And we should have a little yellow slip there in our presentation, and we will include it in future presentations. Let me go to the next slide. This is the 400 million dose slide. Now you may wonder why we have a 220 and we have a 400. What we basically did was we did what the Europeans and the Americans and others have done, which is you purchase and you have an option. These options are actually quite problematic for everybody, including ourselves. But here's the issue. So we didn't have enough money for the full 400 million. We had enough money for 220 million. So we paid for the 220 million, invited the member states to place their orders and to inform us if they wanted more. And we have an option with Johnson & Johnson for them to produce an additional 180 million doses, which would start being shipped, hopefully, from January. So we had a historic meeting last week, and I say it was historic. You don't have meetings like this. There were all the finance ministers of the member states of Africa, because they are the underwriters of this, and the health ministers, and the World Bank, and Afri-Exim Bank, the two funding institutions. And at that meeting, the member states were asked whether or not we proceed to trigger the J&J option. They have formally informed us. They've actually asked for more doses. The World Bank has agreed to pay for all the doses. for those member states that are not self-paying. So this is our delivery schedule, 400 million doses between now and September. We contracted UNICEF to do the distribution. So the vaccines are produced at the Aspen facility in Port Elizabeth and shipped to UNICEF warehouses, where they are then repackaged to meet the order schedule on a month-by-month basis. So this explains to you, sometimes you see that we say they have left, but you see a couple of days, because this is to allow UNICEF to do all the logistics. For example, some of the countries, we couldn't get flights on time to get things through and that sort of thing. But it should settle itself down. So this is the slide that we have. 400 million doses, single dose doses, therefore 400 million people, constituting 30% of the African population. Next slide, please. 30% of the African population being 50% of our target set by Dr. John Nkengasong and the Africa Center for Disease Control. We take our direction from the scientists. Our scientists are led by Dr. John Nkengasong, who in turn works with all the medical regulators of the African continent, all the scientists. We work with our own scientists. And they said 60% is the target. They have not yet revised it upwards, but as long as it is 60%, we are seeking to vaccinate 800 million people. Now, this talks a little bit about the shipments in August, 27 plus the CARICOM countries. The numbers are increasing every day as countries are fulfilling and notifying us. Even as I was sitting here this morning, one country, we have this green amber platform that we have. So another country went green this morning in a bid to make sure it gets into this month's shipment. Let's go to the, let me talk, as you can see in this update, I've also included the United States government and our work with the United States government and COVAX. I don't want to detract from our main purpose this morning, but concurrently, we've been working to ship 25 million doses from the United States government. This is the one initiative in which we are working with COVAX. There are other donor governments that have stepped forward. I won't steal their thunder, but expect that in the next few days, a major government is stepped forward, and we will be making what I hope will also be a very good announcement. Another very important part of this is that, which I will talk about later, is our work with the European Commission, because the European Commission played an important role in the delivery of our vaccines. Because as you know, the shipments for our vaccines were supposed to use drug substance from a facility in the United States. The drug substance was shipped, when the United States facility in Baltimore, called the Emergent Facility, had problems. We switched to a European Johnson & Johnson facility in the Netherlands, and we needed special approvals from the EU Commission because of the export bans, but we got the exemptions that allowed us to draw down drug substance from the European Union. Can we go to the next slide, please? I just put this really for the record. it is not about our deliveries, but you can have this slide. This is a slide given to AVAT by the COVAX facility at a meeting in January. This shows the shipments they said we were to get. We were expecting 15 million in February, 40 million in March. We were to go up to 70 million by April. By May, we should have been at 95 million. June, 190 million. July, 255 million. August, 320 million doses. The WHO yesterday at a meeting informed us that the actual shipments were less than 30 million, 10% of what we were told we would get. If you consider that, if by December, they told us in December, they would have delivered 700 million doses, being 27% of our population. So we all believe that, listen, we've got this nice ramp up taking place of the COVAX donor nations. We would come in August to begin to drive through with the African deliveries, taking us through to September next year. And this is where the crisis is for us, okay? This has not happened. We can all debate about how, where, who did what, how many committees, how many task forces, how many accelerators. You can create all those things. But this is where the rubber hits the road. I'm a businessman and I focus on results. We were supposed to have received by now 320 million doses. Okay, and we didn't get them. I rest my case. Dr. John, let me just give those acknowledgements. This work would not have been possible, as you know, without the extraordinary efforts of President Ramaphosa as our chairman. He is an incredibly active chairman. I've never had such an active chairman because we discuss and we talk and he pushes every single week, several times a week. When we've run into trouble, negotiations have fallen, he's stepped in, he's made the calls, he's pushed. He pushed the World Bank to come to the table. He called President Malpass, called for a meeting in December, and the World Bank came to the table. We acknowledge that. The president of the Afro-Exim Bank, Professor Orama, who is a member of the AVAT committee, he provided the money. Let's not kid ourselves. Without the money, we would not have got anywhere. This one African bank put up the $2 billion. They put it up, they paid the deposits on behalf of the countries before a single country had paid for a vaccine. They put up the money, they provided the syndications, and we need to acknowledge that. This is an institution without a big balance sheet. Yet they put up that balance sheet because Africans were dying. Their shareholders, at the request of the African Union, their shareholders who are big countries in Africa, all gathered together and put up doubled the working capital of the capital base of the bank overnight. I particularly acknowledge the major 10 shareholders, countries like Egypt, Nigeria, the two biggest shareholders, Zimbabwe, Botswana, these countries came together. And forgive me if I haven't mentioned your country's name. But this is a bank owned by all the member states. But the top 10 shareholders gathered together because we did not have enough time. And they increased the capital of the bank, enabling us not to stand there naked. We had been left in a place where our people were completely vulnerable. I also want to acknowledge UNECA, the United Nations Economic Commission for Africa, Dr. Vera Songwe. She is a member of the task force, and she's provided the grist, as we say. She has more than 30 people working behind the scenes, coordinating the ministries of finance, getting the documentation that we need. They organize all our finance ministers' meetings. We never have less than 40 finance ministers when we gather, which is quite a remarkable feat, and I really want to acknowledge them. We also acknowledge the AU Commission, the chairman of the AU, chairperson of the AU, Musa Faki, the PRC, our Permanent Representative Council. John and I report to them on our progress. I am so excited by what they have done, and I have a nice gift for them from Dr. John and I. We are shipping 10,000 vaccines as we speak. They are going to cover the AU Commission and all their staff. They should receive them in the next few days. The Africa CDC, what more can I say? Okay, I have said on my Facebook page that I have a nominee for this year for the Nobel Peace Prize, and it is Dr. John Nkengasong. MasterCard, they came to the party when no one would come. They came, $1.3 billion, guys. We really appreciate that. And the money is buying the vaccines. They're the only ones who've put up real money on the ground for the implementation on the ground. We acknowledge other people. Your names may not be known to people like Professor Peter Piot, who has been an incredible champion for us, often going into the EU to resolve issues, helping John and I understand many critical issues. Obviously, the US government, we have had tremendous input from them, particularly over the last few weeks as they ramp up their own vaccines. Thank you so much. I will stop there. And not to forget President Macron. Thank you so much for the continued efforts from the French government. So we are ready for questions and answers.
Thank you very much. That was Mr. Strive Masiyiwa, who is the African Union Special Envoy on COVID-19 and is also the coordinator of the African Vaccine Acquisition Trust, giving you there the highlights of the distribution that has just started of those 400 million doses of COVID-19 vaccines from Johnson & Johnson. And he has given us quite some details on both the rollout and also on the different actors that have been involved in that process. So thank you very much for that briefing. Colleagues, we now go into our question and answer section. And the very first person to indicate a desire to ask a question is Gabrielle Steinhauser. Good morning, Gabrielle. Please go ahead with your question. Just indicate to whom it is directed.
Hi, thank you so much. It's to Mr. Masiyiwa, please. I actually have a couple of questions, but hopefully they will be very quick. The first one is, who is paying for the UNICEF logistics, the services that they're providing? And then the second question, on the 50 million doses by the end of the year that are coming from the Johnson & Johnson deal, was there ever talk about increasing that? Would the African Union have wanted more than those 50 million? And is that just, how much J&J is able to deliver by the end of the year? And then finally, can you give us an update? Obviously, the US donations have kind of taken longer than foreseen. I think the initial target for the 25 million was the end of June. So maybe if you could run us through some of the things that maybe have held up the pace of these donations. Thank you.
Great. Thanks, Wynne. And Gabriella, thanks. I'll be quick. UNICEF, we're paying them. The member states, it's a fee. It's a professional thing, and we pay them. So we're paying UNICEF for distribution of the vaccines on our behalf. Your second question was, let me remember. What was the second question?
The 50 million, whether that could have been higher.
The 50 million. Oh, Gabrielle, we struggled. That's all they can give us. There's no way of increasing it. So what we have done, as you know, there are pieces around the desk, around the table for this. So this was all we could get out of Johnson & Johnson, and just getting that was a push. We met with every single supplier in a bid to get this number up. We probably will announce another deal in the next couple of weeks to try and from a different supplier to try and get this number up. However, in terms of Aspen, Aspen's capacity, they will add an additional 200 million line in January. You know, there's so many pieces. So, and you know, I feel sometimes like I'm running a train station. So Aspen, to increase our capacity and to do it from Africa, because that's the only thing we can rely on, what is happening on our own continent. So we asked Aspen to increase their capacity to produce more vaccines. And they're adding an additional line of 200 million per annum in January. That's why you see on our slide, the number jumps up, because the Aspen line the new Aspen line comes in January. As you know, Aspen are getting funding from the Development Finance Corporation of the United States, Propaco, the French Development Agency, and IFC. The three of them came in to put in another 700 million for Aspen. It's commercial facility for Aspen to add an additional production line. So that comes in January. So that does help us in that sense, but we will not, even though we feel that we've met our end of the bargain, which was we were to deliver 50% of Africa's need of 400 million. So we could sit back and say we're done. But if the donors are not stepping forward, the people that are dying are our people. So we continue to look for vaccines. The third part of your question was the United States. Look, the arrangement with the United States is quite straightforward. We, as AVAT and Africa CDC, the United States asked us only to help with the allocation. We sat together, we allocated the vaccines with them, making suggestions as to where they were to go. They gave us that respect, which we very much appreciated. But the job of shipping to the countries was given to COVAX. So we have no visibility other than a weekly update as to the delivery of vaccines. Our own vaccines is where our focus is, and it's enough work for us. Thank you.
Thanks.
All right, thank you. I will move on to the next question, but colleagues, going forward, I'm going to have to ask you please to ask just one question per person, and that is because we have a lot of questions that have come in, and we need you to help us to be able to answer all the priority questions that you have. So very quickly, let's move on to Paul Adepoju. Good morning, Paul.
Yeah, good morning. Thank you for this opportunity, and congratulations to Mr. Strive and other members of AVAT. So my first question is, what is being done to avoid the repetition of a similar scenario that we had with Covishield, in which it was not recognized by European Medical Agency? Will this be a problem also with this arrangement with Johnson & Johnson production in South Africa? Then, even though this approach is meant to ensure that Africa is able to control the vaccine doses, we can still, what is being done to ensure that, because this facility is based in South Africa, then when what happened in India should not happen, but if it happens, what is the assurance that South Africa too would not hold on to locally produced vaccines? Thank you.
That's a very good question. That's a very good question. Let me start with, I'll clear the first one, although you should really ask the first question to Dr. John. The vaccine, the Johnson & Johnson vaccine is not like the arrangement between Johnson & Johnson and Aspen is not like the arrangement between AstraZeneca and Serum Institute. The vaccine coming out of South Africa is the Johnson & Johnson vaccine. It is not a licensed product at this stage, okay? Although we would like it to move to a licensed product. And we're pushing that be the case because it will give us greater control. So the Serum Institute has been producing vaccines for much longer, and they have a greater end-to-end process around the product. So they do have to get that product accepted. Although personally, and I think John will agree with me, this whole COVID not being accepted stuff is total nonsense. It is absolute nonsense. The COVID vaccine is the AstraZeneca vaccine, okay? The donors who funded that product are the Europeans and Americans. So how can they give a COVAX money to buy a vaccine and then say we will not accept people to come with this vaccine here? That becomes a silly thing. I'm sorry to say that. On South Africa, guys, the chairman of South Africa is a member of the African Union. It is the president is the chairman of ABABA. So he cannot turn around and suddenly now say, no, you can't ship my vaccines out. The other thing that I need to point out, which we pointed out concerning Serum Institute and in India, it was so obvious back in January, which is that India has a population of 1.3 billion. Okay, and we were saying, so if they are going to ship all those vaccines, what about their own needs? And that's what basically broke down. Their population is the same as the continent of Africa. So to have expected that they would meet their needs, plus our own needs, was pretty naive. I'm sorry to say that, okay? We saw it, we're just a bunch of guys, but how is India going to supply? We asked the question to Indian diplomats. We said, listen, guys, you also have a big need. Oh no, so we were concerned about that. The difference with South Africa is that the South African population is only 50 million, okay? They only need 30 million. So if they can't turn around and say, no, you can't have the vaccines when the plant is producing 400 million vaccines. So don't worry about that. But anyway, I hope it helps us to clarify other issues.
Thank you. Dr. John, do you have a comment?
No, just to complement that, there is no issue of recognizing or not recognizing the Johnson & Johnson vaccines because it's the same vaccines that are produced in South Africa. Some are shipped in Africa, and then some will be shipped to Europe. Actually being shipped to Europe as well. So it's the same, absolutely the same vaccine.
Thank you. So the next question is for you, Dr. John, and it's coming from Bonisile Makubu from the Times of Swaziland. And she says, has Africa recorded any fatalities from vaccine complications? And if yes, please state the affected countries and the types of complications. And she gives an example of blood clots.
That is a very good question. As we speak, we are working very closely with member states to establish what we call pharmacovigilance. That is, tracing any reported side events that will come out because of the administration of these vaccines. And so far, based on what we understand, we have not heard of any, or none has been reported. But we continue to strengthen the system. Remember, we are very early on in this process in terms of the scale up. Our very first inflow of vaccines came in around April and March timeline, and then stopped at that time. And now we are beginning to see that there will be a predictable supply of vaccines going forward. And that will enable us to really establish a good surveillance system to track those adverse effects that you just mentioned. But let me perhaps on that note say that vaccines save lives. I think that there's no doubt about that. And even if we have one or two reported side effects, that it doesn't negate the fact that the benefit largely outweighs any secondary effects that we will have. I'm here this morning because, and perhaps the only reason I'm here with you this morning is because I had my vaccines in April, the full immunization in April. But then last weekend, I came down with COVID. And as you can hear from my voice, I'm still struggling with COVID, but I think the worst is over. And if I hadn't had those vaccines, and if I was gambling with whether I would have side effects there or not, I can assure you that it would have been over for me by now. So the kind of work that we are here discussing today, the announcement Mr. Masiyiwa is here making with respect to the 400 doses of vaccines is truly God's work in action, because it is 400 million lives that will be saved, just as the vaccines have saved my life. So I think let's take it very seriously. Without that, I want to be very, very clear, I will not be here, because even with the breakthrough infections, the severity of the attack is still so unbearable. I mean, the headaches, the fevers, every part of your body is basically affected there. So Strive, thank you for what you do. I mean, you acknowledge everybody except yourself. I think just for the record, I've never met Mr. Masiyiwa other than on the platform that we work every night to secure these vaccines. But I must say that it has been a learning exercise, and he's truly the hero. I mean, I call him in our informal discussions as our COVID vaccine warrior for the continent, because he knows exactly where every vaccine is hiding, and he has had talks with them. He calls me in the middle of the day and said, John, I just called this company and they're having this vaccine. Let's get on the call and find out what is going on there. He knows every vaccine that is going on across the continent. And perhaps when the history of this will be written, and I'm sure it will be written. I think the history of Africa was written during the 1960s, and those who were heroes were the Kwame Nkrumahs, the Jomo Kenyattas, and the Haile Selassies. The modern days Pan-Africanists will be, in my view, people like Mr. Masiyiwa, who actually rose up to the task. This is not the first time he's doing this. When we were in acute needs of diagnostics, he was the first person who created the African Medicine Supply Platform, which completely unblocked our situation with respect to testing. Without testing, you can't fight a disease. So our work is always to determine as Africa CDC what we need, and that is where we end. We don't know how to move it forward because we are limited. But people like Mr. Masiyiwa, Professor Bennett Orama, and Vera Songwe come in with all kinds of innovations and get it done. We call that a new public health order for Africa, where Africa takes Africa's own citizens, use their own assets to solve their own problems. I think this is what we have been describing as a new public health order to guarantee our health security. And one of those champions truly is the person you are seeing in front of you, Mr. Masiyiwa. So Strive, a very personal thank you for your devotion, for leaving your business for almost 1 year, 6 months now, to devote entirely your efforts to trying to save the continent. And this is truly God's work in action. Thank you.
Thank you, John.
Thank you. Thank you very much, Dr. John. And thank you so much for sharing that personal testimony about what you are going through and the help that the vaccines have lent to your recovery. And so we wish you a very speedy recovery. Get well soon. Thank you so much. We move on again. And colleagues, I need to ask you again, please, to just stick to your one question so that we can attend to as many people as possible. Next up, we have Sophie Mukwena from the SABC. Good morning, Sophie. Please go ahead with your question and tell us who it is directed at. Good morning, Sophie. Hello, Sophie.
Thank you. I was waiting for you to allow me in. The question is about the issue of reaching the herd immunity. Based on what we were told today in terms of the delivery of these vaccines, 400 million doses Johnson & Johnson, unfortunately, it is one dose. In terms of the target of the Africa CDC, the continent itself, are we likely to meet the target for herd immunity? Because many people are now beginning to question whether it's possible. And if we don't, the economic growth of the continent, we saw the report from the World Bank and IMF, it is doom and gloom. So only the vaccine can help us to turn the corner. Are we likely to be somewhere with this allocation? The question is directed to Dr. Nkengasong and that is stress.
All right, Dr. John, please go ahead with your answer.
No, thank you, Sophie. I think when we established the target of 60% need to immunize 60% of our population by the end of 2022, last year, it was based on the understanding of the epidemiology and the virology and pathogenesis of the virus at that time. And now we know more than we did at that time. And what do we now know, which is different from that time? One is the variant. When we did this analysis, which was informed by science and our population structure, the following assumptions were made. One, that 40% of our population is less than 18 years old. And at that time, the other assumption was that those who are below 18 years would not need to be vaccinated because they didn't really come down with the disease. So what has changed? We now know that because of the new Delta variant and other variants, those who are, anybody is vulnerable now, okay? I mean, the young people are falling sick and they're dying, and so that assumption needs to be factored into our new projections, which when we finally put a scientific group together and we work on that, we'll come out with a new projection. The second thing was the variant. At that time, we had a the wild variant, which was just the only variant that we knew at that time. But with this variant, we know that the rate of reproduction of a virus is how many people an infected person can subsequently infect, was limited as about 2.5. And now we know that with these new variants, that rate is more than that now. So we need to factor that into our collective analysis. But the most important thing is to achieve a 60% target by the end. If we do that, then we are on our way to at least doing any adjustments. Any adjustments would not be impossible to achieve at that time. It could probably be just adjusting it to maybe 75 to 80% of our population. So the foundation of our success is to get to 60%. Once we get there, then we should be able to quickly adjust if there is need to adjust upwards to get there, which I think there will be need to make those adjustments based on the virology, the pathogenesis of the virus that we are seeing there. So I think let's remain positive. The key here is for all of us to work collectively so that as these vaccines that are beginning to be introduced on the continent arrive, they should get into people's arms very quickly. If we vaccinate at speed and at scale, then we blunt the emergence of these variants, and then we don't have to deal with them later on. So I think that is extremely important, and it is everybody's what I call collective responsibility and collective accountability.
Thank you very much, Dr. John. We are really running into trouble with the time, so we will just move on very quickly. I'm hoping that our producer will give us an extra few minutes so that we can mop up the remaining questions. So the next one is for Mr. Masiyiwa, and it is coming from Esther Nakazi, who is a freelance journalist. And she says, with the incompetence of COVAX, why should it not just be disbanded and we rely on another entity? That's for Mr. Masiyiwa.
No, that is not my place, and we are certainly not calling for that. We are calling for an improvement in the way things are done and accountability. you know, but beyond that, we work closely with them. We are set to have a meeting this afternoon. We are part of the accountability mechanism because we demand accountability. If somebody steps up and says, I'm offering to do this, we're going to do this, then either they do it or they give us good reasons as to why. But disbanding, no. We have to improve and make these things work. And so that's where we stand.
All right, thank you very much. We move on to Neria Gonzalez, who is from the Spanish news agency EFE. Neria had sent in 2 questions, but I will take one, and that will be the one that says, the WHO's Director General called yesterday for a global moratorium on booster shots until the end of September. May we have the Africa CDC's reaction to that request? So that's for you, Dr. John.
No, thank you. Our position is clear that we need to vaccinate as many people as possible with the available vaccines before we start looking into booster shots. So our position is pretty aligned. And I think our position is informed by the fact that unless we do what I've just said, we run the risk of creating more variants. I mean, because we continue to exert suboptimal pressure on the virus and it will mutate and then even continue to infect those who have received their vaccine. Again, I'm a good example. I received my full doses of the vaccine in April, and look, I have a breakthrough infection. So again, the only way to stop this pandemic is to vaccinate many people so that we really blunt the spread of the virus circulating. So I fully agree with the WHO position, if that was possible.
All right, thank you. We have a question coming from Christine Palitza, and Christine is with the German press agency, the DPA. She says a recent AU survey of 15 African countries showed that skepticism about the COVID-19 vaccine remains high in many countries. If some African countries don't achieve their immunization targets, will COVID-19 become endemic in those countries? And what would the consequences be for the rest of the continent? I think that is for you, Dr. John.
No, I think the situation in Africa is changing a lot. I mean, when Strive mentioned the meeting we had just last week with all ministers of health and ministers of finance, the World Bank, minister after minister, from Senegal to Namibia, Botswana, Malawi, we're all telling us how people are out there on the queue, waiting with their arms stretched out, waiting for vaccines to be administered. Senegal, for example, used to immunize about 2,000 people a day. Now they are up to about 50,000 to 100 people a day. So they are yearning and looking for vaccines. I think the situation is changing speedily in Africa. The only thing that we needed in Africa was a predictable supply of vaccines. And now that we see that coming through this AVAC process, I can assure you that the whole question of vaccine hesitancy will change because people are seeing loved ones dying in numbers. So I think that the situation is going to dramatically change as we see people begin to take their vaccines and see that it's begin to save lives as it has saved my life. So I think I have no doubt with that and no concerns at all on that anymore.
I can add, Dr. John, without naming countries, there are whole countries that would not participate in the beginning. But as we stand right now, we are on target to deliver to 45 African countries by the end of September. You know, so we have countries, there was one comment by a minister who said they received their first doses of vaccines and nobody took them up and they expired. They received a shipment last week or so, part of the US government donation, and they were all taken up in 3 days. The minister could not believe the queues. And now she says we've gone from people not interested to people protesting that we don't have vaccines. Why don't we have vaccines? The reality is hit the ground. we are not concerned about anti-vaccination campaigns. That's completely outside. Let us get to 60%, like everybody else, and then we will deal with that problem going forward.
All right, thank you very much for that. We have a colleague called Ndei Sisai who is online. Ndei, please tell us your organization and ask your one question, and also advise to whom it is directed. Ndei, please come in. All right, we seem to be having some challenges with reaching out today. Let's move on and take a question from Katarina Hohi. And she says, I have a question for Dr. John Nkengasong. What is happening with Eritrea? Is the country considering starting vaccinations against COVID-19? And Katarina is with Bloomberg. Dr. John.
So as Strive said, we continue to be encouraged by the progress that all our 55 member states are making towards vaccines. You remember just a few weeks ago, it would have been 4 countries that we are still struggling with, and that was Eritrea, of course, Tanzania, Burundi, but that situation is changing very quickly. You know, Tanzania is fully on board now. I was just as I mentioned to you all last week, and met with the head of state. The situation took her vaccine live. So no situation is static with these countries. And once I recovered, I think I'll be exploring ways to get to Eritrea and to Burundi. Our policy is, our strategy is simple. Leave no country behind in Africa. However is difficult, we will go there with Strive and others to meet with the leadership and say, look, this is dangerous for our continent. We cannot leave you behind, and join us in this. So watch out for subsequent trips to Burundi and to Eritrea if the situation doesn't change.
All right, so thank you. Another question that is directed at you is coming from Sarah Jerving, who is with DEVEX. And Sarah says, can you please talk about your findings from the Africa CDC's mission to Seychelles? What does it say about the efficacy of the Sinopharm vaccine?
No, that is a very good question, Sarah. I think we now have a very comprehensive report from that country. I think what led to that outbreak of the infections there was not related to any of the vaccines there. It was related to the eagerness to ease the lockdown. I mean, Seychelles' economy is driven mainly by tourism. So they were really struggling and started relaxing public health measures very, very early. So that led to, I mean, it's really an increase, a dramatic increase in the number of infections there. So had nothing to do with Sinopharm or any other vaccine that they used at that time. That's what our evidence is telling us. And on this, I'd like to thank you all for being patient with us. We promise you on this platform that we will tell you the stories as it is. And you are hearing today the narrative from Strive is what I call the epitome of transparency, to giving you exactly the information that we know. I know over the months, you all have been asking questions on AVAC, and we kept saying, well, we are not ready to, but we want to come to you with clarity. And I think that what Strive has given you today is epitomize that transparency and full accountability of what we are doing. And I think the same with Seychelles. We couldn't give you any earlier information because our team was analyzing the data, but now we have a full understanding of that. The second thing and last I'll say is that it is very difficult at this point for anyone to have made judgment that it was based on any vaccine because outcomes were poorly defined. That is, in order to make that analysis, you need to know when people were vaccinated and what became of these people. Okay, and that data was still very, very sketchy when our team arrived and did the analysis there. So the main finding is that they eased the lockdown very quickly. So the viruses circulated quite rapidly because they rely on tourism for their economy.
Yeah,
right,
and
thank you.
I would also like to add something on Seychelles, just by way of clarification. Seychelles also received the Covishield vaccine. we organized the shipment of Covishield AstraZeneca vaccine to Seychelles. And so when you consider the population of Seychelles, that was not a small volume. We can check it out, but I remember it was about 20 or 30,000 vaccines went to Seychelles that came from India. So what this tells us is the elephant in the room is the variants. Okay, that's the other side of this that none of us saw, as John pointed out. So the variants are reducing also the efficacy of vaccines. To what extent we are all still waiting for all that data to come through. But we can't sort of say, because of this, we'll not touch Sinopharm. Sinopharm is an approved WHO vaccine. And we engage vaccine manufacturers from every part of the world, and we then inform the governments what's available and wait on them to tell us whether they want that particular vaccine.
All right, thank you. My producer tells me that we have time for only one last question. And I think we'll take the question from Akin Jimo. And Akin is with the journal Nature Africa. So Akin says, there seems to be an imbalance between vaccine supply and demand or social mobilization. So what strategies are there for improved uptake of the vaccines in the face of misinformation? That is for you, Mr. Masiyiwa.
No, it's actually John's question.
All right.
But I'll have a shot at it and then let John finish off. You know, I didn't expect John to be here today, to be honest. It's just quite extraordinary. When we planned for this press conference yesterday, we had to have a contingency. Will John be available for this press conference? And really, I just want colleagues to acknowledge the dedication of this man. But vaccines work. There's a beautiful graph which John showed the ministers of health and finance last week. Well, most of our ministers of health are clinicians, and they all know that vaccines work. And we don't have a top-down approach to this. We rely on the ministers of health. There are ministers of health who are part of ABABA. They are the ones calling the shots on what vaccines come in. They are telling us now that there is no hesitancy of concern that is material enough to cut down the orders. Look, the orders for 400 million vaccines came from your governments. These are vaccines your governments are paying for. If these government vaccines are not used, it's going to be your money. These are not donations, okay? So you can hold them to account to say, what's happening, okay? My job was a simple one. Go out, find the vaccines, finance them, negotiate, get them in, get the governments to approve the choice of vaccine. My last point is this. One of the challenges that we did not see with vaccines was, yes, they work, but the durability, the period within which they are working effectively falls. Okay, what we know is some are about 6 months, 8 months. This was a major factor in our engagement in the choice of Johnson & Johnson, because we don't have a lot of money. So what we know now is the published data on Johnson & Johnson, which has been publicly announced, is the durability is at least 12 months. So vaccination is here to stay. It's going to be a battle on an annual basis. It's going to be a battle with variants. These are things we now know. But the most important thing we now know, and I wish John had that graph, almost 99% of the people that are in hospital with COVID in the United States had not been vaccinated. John, am I right with that stat?
Absolutely, 99, exactly, 99. You have very graphic memories, 99%.
It hits you. 99% of the people in hospital in the United States did not get a vaccine. And these were people who had a choice to have it. They can get it in the subway, you know, and they can get $100 if they take it. I wish they'd just give us the money and the vaccine. We could use that, okay? But the critical issue here is vaccines work, okay? Do medicines have side effects? Absolutely. I can get bleeding stomach from paracetamol, please, okay? But we have to balance risks, okay? You go to the graveyards right now, they are burying COVID people. You know, it's there, it's real. Okay, so let us follow the science. The science is Dr. Nkengasong and all his colleagues at the Africa Center for Disease Control and the Centers for Disease Control in every African country. There's no African country that doesn't have one. So we are organized. We may not have all the money that others have, but that doesn't mean we don't know what to do. Thank you very much for your attention.
All right, okay. I think you answered that question very well on behalf of Dr. John. So the producer has said, let's take this one last question, and it's coming your way as well. And the question is coming from our colleague Ndei, and he says, Mr. Masiyiwa said during the briefing that batches will be sent to 9 Caribbean countries on Monday.
6.
May we have, well, he wrote 9, so I think let's correct him to 6. Thank you for that. May we have the breakdown of those countries? And specific names were not mentioned for Caribbean states. Then he goes on to say, unfortunately, he would have liked to ask another question, but he's sticking to the one question rule. So perhaps you can just comment on those 6 countries and mention them by name.
I can't mention them by name because I don't remember, but we can get that data out to you. I can give you some of them. The Caribbean countries are small. So the biggest one of them is Jamaica. They take about, I think their order is about 40% of what's coming from the Caribbean countries. Then come Trinidad and Tobago. They're about 800,000 vaccines that they ordered. Then the others come in small, Barbados, Belize, and so forth. This is not material, but if you want the list, we can get it out. Okay, so their shipments go out. Some of them are very small, 13,000, 20,000. But this is the key to a pooled purchasing platform. This is the first time that Africa has gathered together to do something together on an economic level. We've always done things together on political and national security issues. But since we launched the Africa Free Trade Area, we are mandated as servants of the continent to find things we can do together. That is why it is so symbolic. You will see over the next few days, almost every head of state of the African countries issue a statement to welcome the receipt of their vaccines. Some are going to the airports to receive their vaccines. Why? Because we know its symbolic and strategic nature. Africa is 1.3 billion people. When we work together, we are a roaring lion. We are going to work together now to get the economic side driving forward. We've always protected each other on national security issues. That's why you have African troops fighting in Mozambique, fighting in Somalia, in these areas. We will send troops, we do, but we've been on national security and political challenges. Now we are saying on a challenge like this, we can come forward, raise the money, and try and solve a problem. But we still need partners. We need partners who trust us. We need partners who are willing to work with us. and we need our partners to meet their side of the commitment and not just make pledges.
All right, thank you very much. It's time for us to bring our briefing to a close. For colleagues who still had questions, I can see some of them here can be answered from the slideshow that was presented earlier by Mr. Masiyiwa. So please, those of you who still have questions and would like to have a look at that slideshow, just indicate your interest by sending your question or your request to Neke, and he's on +251 94 550 2310. So he'll be able to assist you as far as those questions that are related to the presentation are concerned. So it's time for our summaries for today. Let me start with Mr. Masiyiwa in 1 minute or so. Please give us your main headline points.
Actually, I have none. It has all been said. We've started our shipments. It's a 12-month exercise. It's, so countries know. What we've given you are the big numbers, but the countries know the schedules. They placed orders. We didn't allocate to them. So your country may have ordered a lot, or it may have ordered few. Okay, but our task is to give them the deliveries on a month-by-month basis, and we hope that you give us all the support that is necessary to get it done.
All right, thank you very much. Dr. John, your last words for today.
No, thank you, Wynne. Really, my last word is my sincere appreciation to the commitment and devotion and sacrifices that Mr. Strive Masiyiwa has devoted over the last 18 months in this pandemic. I remember the first time we had a call, and this is not the first time he's involving in health issues, that he was active during the Ebola outbreak in West Africa, but I have not known him before. I didn't know him during that period. And just in that period of March, we started talking about how do we unlock the situation of diagnostics in Africa. And then he came up with this magic solution of a platform to get the diagnostics there. So since then, he has devoted, as actually say, most of his time. I think it's fair to say that he devotes about 90% of his time away from his business to investing in this, the need to find solutions to solving Africans' problem. I think I start there because it squares in nicely with what we have been arguing as Africa CDC, that we need a new public health order for the continent that will ensure that Africa takes leadership in finding solutions for its health security. Ebola was a signal that something big was going to come. And then we must consider in our minds that COVID is another signal that something even bigger and worse it will come, okay, in terms of the next pandemic. And if Africa is not organized, and the likes of Mr. Masiyiwa, the likes of Professor Benedict Orama, the likes of Dr. Vera Songwe, who commit themselves every day to working together, working on calls till 12 midnight every day, Africa would not take this leadership. So we should be really celebrating today's event as the beginning of that new public health order. The second message I want to leave you all is that the vaccines, we are moving steadily from vaccine farming to a vaccine feast, but we should do our part. And all of us should contribute to continue to make sure that the vaccines are used, that we dispel any rumors about vaccines. Vaccines save lives. I think that should be a central theme that all of us spread through our social medias, through our relatives where we are, through our family members, our church groups and community organizations that we participate, that these vaccines are coming and they save lives. I think that is extremely important. And lastly is really to say that, I mean, transparency is a cornerstone of what AVAC does. And you've seen with great details, and we'll be happy to share the slides with you, that you see how transparent this process is, and member states paid for these vaccines, and they will receive the vaccines. The schedule is there. If something happens with the schedule, we'll report back to you all that we have hit a roadblock in that, but we don't anticipate that. But that is the kind of transparency that we want to ensure that as Africa takes leadership in ensuring and guarantees its own health security, it should be characterized by such transparency. So thank you, Strive, for being extremely detail-oriented with respect to what we are doing and answering all the questions on ABAC. We will plan to brief, I'm sure, the Bureau of the Head of State in the coming weeks, so that everybody should have the same level of information as these vaccines roll into the countries. Thank you.
Thank you very much, John. So, and thank you, colleagues. Our press conference has come to an end. I want to thank our two panelists, Mr. Strive Masiyiwa, who was talking to us there about the rollout of the 400 million doses of Johnson & Johnson vaccines, not just to Africa, but to the Caribbean countries as well. And these were acquired through AVAT, a vehicle that was put in place by the African Union. Let me also thank Dr. John Nkengasong, the director of the Africa CDC, for being here. You heard him say that he's recovering from COVID, and he gave us personal testimony, which I think should really strengthen all of us to take that word seriously about how vaccines, the importance of vaccines in protecting us against a severe illness and or something even worse. So on that note, let me wish Dr. John the best. I hope you get well soon. And just to say, we need you to be fully on your feet again to continue the good work that you are doing. So thank you, colleagues behind the scenes, everyone from the Africa CDC. I can see that we have colleagues there. Dr. Ahmed Ogwell, the Deputy Director, is with us. So thank you very much for that. Colleagues from the media and everybody who was watching, let's meet again next week on Thursday at the same time. Bye-bye for now.
Yeah, bye-bye.